Hi, I'm Dr. Fred Ferlic. I'm a co-inventor of TayCo External Ankle Brace. I was born and raised in a small farm town in Iowa, so I learned the value of hard work and somewhat biomechanics. And then I went to University of Notre Dame. I went out east for my medical school residency in the Midwest, and then finally settled in South Bend, Indiana because of my allegiance to my alma mater. It's important when you're documenting this brace to know that you have to answer two questions. Why does a patient need a brace or an AFO, and why does a patient need this particular AFO? Okay, so let's take PTTD. The patient needs this to prevent further collapse of the talonavicular joint, forefoot abduction, hindfoot valgus. The patient needs a TayCo because that will prevent talonavicular subluxation, forefoot abduction, hindfoot valgus by controlling the shoe. And I would advise using an orthotic, obviously, with all TayCos, because the patient's there because they have a biomechanical problem. And biomechanics are only solved really with some type of orthotic. And also with documentation, besides asking those two questions, it's just a matter of history, physical, x-ray, the usual things to put in. Now don't forget, with documentation for a TayCo XAB, answer those two questions. Why does a patient need an AFO, and why do they need this particular AFO? And then when it comes to L code 1971, it's a custom fit brace. So that means you have to document whether you custom fitted it, which is bending, molding, or trimming. In other words, everybody has a different size calf, so if it's a large calf, go to the side of a table and just bend these uprights over, and they'll retain what you bend on them. Okay, bend them out. If they've got a skinny calf, bend it in, and then document it. I bent the uprights to fit the patient's calf. If they have an old exostosis over the base of the fifth, just take your heat gun or use a $12 butane torch from Walmart, heat it up for 10 to 12 seconds so you get a sheen, and then push it out with the blunt end of a screwdriver, and it'll form a little bubble where and accommodate the exostosis.